Hi, everyone. It's Catherine Bishop, OEA President. I'm here today with Dr. Donna Tyungu, pediatric infectious disease specialist at OU Health Science Center. Welcome, Dr. Tyungu.
Thank you. Hi.
Well, we are glad to have you. And it's just Catherine and Dr. Tyungu today. Carrie Jacobs, your main host of the podcast, had a scheduling conflict. So Dr. Tyungu, it is such a privilege to have you back on our podcast. I know you've been on with us before and highly listened to podcasts because this is such a evolving issue, this global pandemic that we are in, that we had hoped to be kind of tampering down, but it looks like it is not. So I just wanted our audience again today, just tell us a little bit about yourself. Where you're an Oklahoman, right here from Stillwater, Oklahoma. So tell us a little bit about yourself.
Yeah, I was born in Stillwater Medical Center. I went to high school, grew up in Stillwater. I went to high school there. I did do summer schools at OSU, and I went to college at Indiana University. I did medical school in Michigan at Michigan State University. I came back for residency in Tulsa, and I did an internal medicine pediatrics residency, and then I did my pediatric infectious diseases training in New York City and in Houston. And then in 2017, I came back to work at home for OU, even though I like to say go Pokes, but still.
I'm right there with you. Here we go. So nobody can see my little pistols firing on the podcast, but they're there. I'm right there with you, Dr. Tyungu. So let's talk a little bit about I have like a bazillion and one questions for you. And I know our listeners do too. So when we look at the community of infectious disease specialists, epidemiologists, all those big words that I really don't know, did we foresee a global pandemic coming our way?
It's such an interesting question because all throughout my training, actually, we did discuss when is our next one? 1918. So I was still in training. No, I had just finished for a whole year. But from the years of 2014 through 2017, the big question was 1918 was our Spanish influenza. We are about 100 years from there. Where is our next pandemic? And we've had little blips of what looked like might have been pandemic things, like the 2009 influenza pandemic that we had. We got that under control really fast. But I don't think any one of us expected a coronavirus to be that. And I think a few of us are still a little nervous that there could potentially still be another influenza pandemic behind this. God forbid. But I think the coronavirus was the surprising part.
Wow, you're expecting not the coronavirus, something maybe bigger than that, or influenza.
Really influenza. I think influenza is just ripe and ready to change genetics, and we know it goes through pigs and birds and things like that. Oh. And most coronaviruses we've always thought were droplet spread, not this airborne type of spread that we have now. So through this time, it sounds like it is so much more contagious than what was even expected, right? Oh, absolutely.
Okay.
And it has even become more contagious, as this pandemic has gone on. Yes.
So the buses are rolling, the kids are coming back to school. So let's talk a little bit about the variant that we have right now that is surging. We have over 600,000 students returning to classrooms without the prevention layer of being vaccinated. These are not the ingredients we need to have a successful start to our school year. I don't know, maybe it is, but this is really our educators. One told me the other day, she said, last year it was the fear of the unknown. This year is the fear of what we know. So talk to us a little bit about the variant that's happening right now and your biggest concerns for that.
Yeah, I didn't realize it was 600,000 students going back. Uh, I mean, you could put that in stark contrast to how many Americans we've lost to this pandemic, right? Because we've lost
Right.
over
Oh, yeah.
650,000 people to COVID-19. The way I've been trying to describe this to people now is like, we need a completely new mindset about COVID. We call it COVID-19, but what came out of China in 2019 and took us all through 2020 is completely different than what we're dealing with now. Like, the genetics of this new variant have changed to a place where it's 200 times more infectious. Each person who has the virus can transmit it much, much, much easier than they could in 2020. And so the other added thing is that we know that children in 2020 were generally protected because of the type of receptors that they don't have enough of these things called ACE2 receptors in their nasal lining. And so that we think that that's like the receptor needed to kind of take the coronavirus into the body. And so the virus has changed in such a way that now it overcomes that receptor protection that children had. And that's why we think children are much more able to get this variant as opposed to before.
Yeah, I even saw the other day where they're now calling it different. Like that was the last year was the Wuhan virus, and now we're talking about the Delta. So they're actually trying to disaggregate the two different viruses, which I'm glad you said that. So we need to have a reset and look at it at a different way.
And it's kind of a blessing though, because we have all of the expertise, with what we call it the wild type, right? The original strain that first came out. We have all that expertise, and we know we got a chance to learn so much about how to protect ourselves before this strain even came around, So that's why it's a little frustrating for us if we know what to do, and then we're not going to do that. It doesn't make a lot of sense.
That is frustrating. That could lead me in all kinds of different directions, but I'll try to stay focused on the topic. If we had talked earlier, what with the new variant and knowing that it's affecting our kids at such a higher rate, what is something that symptoms that a parent needs to be looking for, that they need to not overlook and think, oh, this is just, I've got allergies or whatever?
Yeah, and so that's a great point. So with the Delta variant, symptoms have changed. Let me just pull this back up. So, and symptoms are different if you're vaccinated versus unvaccinated.
Oh my goodness,
okay.
I didn't know that.
So if you're unvaccinated, more people actually have headache, sore throat, runny nose, fever, and a persistent cough, as well as that loss of taste or smell, and in that order. So someone may come who's an unvaccinated teacher, for instance, and they just have this terrible headache, and they think, oh, this can't be COVID, but that's not true, because if you're unvaccinated, headache is that number one symptom that actually presents now. And then if you've had 2 doses of your vaccine or the Johnson & Johnson single dose, the most common sign of infection would be runny nose, and then under that would be headache, and then sneezing, which sneezing was completely not a part of it last year.
Yeah. You just thought you had allergies last year.
Exactly. Yeah. And then sore throat. And so it's changed. So loss of taste and smell used to be for us as physicians like a nice trigger word, but we may have people coming in just with allergy symptoms who are actually COVID-19 positive. And so that makes it much more complicated.
Did I hear that you become symptomatic much faster, that exposure period is quicker with the new variant than it was with the previous virus?
And so we think that's because there's just so much more virus around. So the body responds faster than it did before.
Yeah. So that leads me to, so you think, okay, I got a headache. I've got this. When should you be tested? And what is the best test to take?
So if anyone is suspicious that they have COVID-19 or they feel sick or anything like that, they should go get tested right away. And even if that very first test is negative, 2 or 3 days later, they can get tested again to make sure that it's like really negative. The best test obviously is PCR.
Mhm.
There's 2 different tests you could do. You can do antigen testing and you can do PCR testing. And so antigen testing is fine. It has a good sensitivity and specificity, but the problem is if it's negative, then you want to just make sure you confirm it with a PCR test.
Oh, okay.
If it's positive, you can believe it. Like that's a true test. Yeah.
So the antigen, that's the rapid test, right? I want to make sure there's all this stuff.
Yes.
So the rapid test, which is quick, it's fast, it's easy. PCR, they just have plucked a piece of your brain out of your head. That is, but so if it's negative, then follow it up with the PCR test. But if it's positive, you can guarantee you don't have that many false positives on the rapid test. Did they ever come up? I know they were talking about a saliva test, all that other.
Yeah, those are options. Yeah.
Okay.
Yeah. Whatever. The lab has to be prepared to use a saliva sample with their testing that they have. So it's kind of on the other side, it's lab dependent if the lab is able to take that sample.
Do you feel like our state has capacity now where you can, at the beginning, it was like, I can't find a test. I can't get into a test. It's going to take me 7 days to get the results. Do we have capacity now where you can just go get a test and quickly get your results back? Oh, sure.
Yeah, we're in a completely different place than we were at the beginning of remember last year, we didn't even have masks for healthcare providers. Yeah. I think the message to get out to people was if you think that you could have been exposed and that you're sick, that you absolutely should go get a test because you should try to not have yourself in a congregate setting like school if you're actually COVID positive. Right.
And so, or if you think it, just quarantine and stay away. That all those things, all those layers of protection that we had implemented to help mitigate this, any of those that we can go, we don't need those anymore.
No, I personally think that all of those layers of protection was why, first of all, schools did so great last year.
I agree.
In addition to the fact that students, were less likely to get ill with COVID-19 and things like that. And they probably got infected less. But yeah, all of those mitigation factors that everybody worked so hard to come up with and do, figure out should absolutely be implemented today. For sure.
Yeah. Universal masking is, top notch, what has to be done. And social distancing, the testing, the tracing, all that. Who would have thought that districts were going to become testers and contact tracers? We know more about public health now than we ever thought we would ever know. So let's talk.
It's kind of neat though, if you think about it.
Yeah,
everyone living on the planet today is essentially a COVID-19 expert, right?
Right.
Because if they're alive 80 years from now, right, that's our goal, living through a pandemic, we need to survive, right? So if you're alive 80 years from now, your grandchildren and all the people around will want to know everything we have to know about what we lived through during this pandemic. It's kind of neat when you think about it that way, because, oh my gosh, I would love to sit down and interview someone who survived 1918,
Right. So. And they wore masks back then.
They sure did. But it was it's very interesting. If you sit down and go through the history of 1918 and compare it to ours, all the arguments were there. There were anti-masking groups. There were political situations against public health messaging and all of the things.
Oh, wow.
It's so crazy how history repeats itself.
Interesting. Fascinating. I did not know that.
Yeah.
So let's shift.
There was even a Fauci. There was a Fauci who was in the newspapers. You can see it in black and white newspapers that like people were making fun of him because he was advising people to wear masks at the time. So
yours, your specialty is infectious disease.
Mhm.
How does your field collaborate, work with the pediatricians and the general practitioners so that, in education, we always like to say we like to have common language. We want to have a common message. Tell us a little bit how you guys are working together to make sure that we're taking care of our kids right now.
Yeah, so I mean, as I was mentioning earlier, there's only 2 of us in the state. And so both me and my partner, we take calls from all across the state for any infectious diseases concerns or needs, and we see patients here. We also collaborate with like the Oklahoma Pediatrician Group, the Oklahoma Association of Pediatrics, and so we help with the messaging that comes through there. Obviously we meet every single week with our pediatric colleagues here for, grand rounds and different things.
Right.
And so, yeah, I mean,
Right.
We try to be on the same page with everyone. And I think the vast majority of pediatricians, not even not even nationally, like worldwide, the vast majority of pediatricians has pretty much the same message with regard to COVID-19 in children.
Right. And knowing that it's, I think it was Dr. Chancellor, he said, a variant is created because it's looking for a host. It wants to live. So it's going to like change its raincoat. It's going to just change its coat, and it's going to, but it's looking for a way to live. So if we can keep it from looking for a way to live, what is the number one thing we can do to stop this?
Yeah, sure. Vaccination. Yeah, vaccination is the number one thing to do to stop it. But I mean, we all learn in biology, right? Survival of the fittest. And so that is what these variants are. They are the only opportunity they have to even mutate is another host to infect. And what's a little concerning is with this Delta variant, and there are more variants that we've already identified behind Delta. I'm sure people, maybe they don't know, but anyway, people should know. And our biggest concern as infectious diseases and epidemiologists is the variant that will escape the immunity that we have found through vaccination.
Oh my goodness.
So nobody likes shots. It's not like we like shots. Right. I don't like getting shots either.
Oh.
But it's so important to stop the spread of this virus.
So if we could get more, let's just say today's August the 11th, if we could get more people vaccinated, there is a way to at least bring this down. There is hope that we can give to say, but it's at least going to help stop any, hopefully, creating future variants.
Yeah, absolutely. We even have data. We have data from Israel and we have data from the UK. They had very high levels of vaccination in their communities. And even though they started having outbreaks again, the link between infection and hospitalization was broken, which means the link between infection and death is also broken. And so we don't have those levels yet in our state or in our country. And so when people are getting sick, especially if they are unvaccinated, they still have the same risk of winding up in the hospital. Actually, they have greater risk of winding up in the hospital than they had even with the original strain. So let's
debunk some myths that are out there.
All right. Let's do
it. This is a common one that I hear often, especially now that 12 up to 12 and above can be vaccinated, that it's going to sterilize my children.
Yeah. So no. We don't have any evidence that there's going to be any fertility issues whatsoever. Honestly, we've had women who've been vaccinated who've delivered their babies, and a potential benefit is that those babies are born with immunity to COVID-19 because every baby born has whatever immunity their mother has, at least until 18 months of age.
Oh.
Yes. And then if the baby breastfeeds, they'll get even more, like they'll continue to get immunity through breast milk. Yeah. The truth about fertility, sorry, I have my whole myth busting folder here.
Yeah, good.
So the
Good.
truth about fertility is that there is much higher risk of problems with fertility if you get infected with the virus. So hold on, let me find it here. So the true risk, if you're pregnant and you get COVID-19, you are at much greater risk of getting sicker and requiring hospital care. The saddest case, and I don't even know if I can talk about it without getting sad. Hold on, I'll tell you. And this was not even Delta variant. This was before, when we had a pregnant mother who got so sick that they called me to ask how to safely get the imprint of the baby's feet, because the mother was dying and the baby also died. But they wanted to get, what we do in these situations is imprint the feet for the basically the father and the other children that survived. And you know, even now when I see pregnant women, I just, you know, my hope is they're like vaccinated, but when I see pregnant women, even in Target, just walking around with their faces open, I'm just like, gosh, what do I do? How do I tell them to just protect themselves? Because unfortunately, when you're pregnant, you are considered immunocompromised because your body is doing so many functions at the same time, trying to grow another human being.
Right.
And so
sucking the life out of you there. Yeah.
You're at greater risk for infection. So
if you are pregnant, it's safe to be vaccinated. It's great. That is great news.
And also there's increased risk of preterm labor if someone's pregnant. Now, what men don't understand is that when they have COVID-19 disease, that can actually impact their testicular function. It can impact their sperm production. And it can impact the male fertility. Okay. So not the vaccine, actually letting yourself be unvaccinated and go through disease. It can have, and also impact male hormones. So there is, by having the virus and, you know, contracting it is probably, you're at much greater risk long-term than getting the vaccine for it, is what I'm hearing you say. Yes.
That's safer.
I should say the American College of Gynecologists convened a national expert group, and they concluded that vaccines should be offered and are safe for people who are thinking about becoming pregnant, wanting to become pregnant, who are pregnant, or who are breastfeeding.
Okay. That's all great information to know, because we have lots of educators that are childbearing, and we want to make sure that they are safe as well, coming back to school, being in person. So have we found any chips, microchips, anything like that? What is the biggest theory that you yourself have to debunk as a physician?
You know, all of them. I guess for my adolescent children that come to the biggest problem they have is they want to know that they're really not going to be magnetized, because I think that was like a big TikTok thing that was out there. Yeah. And what people were doing was like taking small little metal things and like sticking it to them and say, look, I'm magnetic, right? But what people don't understand is that we all have like a layer of sebum. It's just like, you know, our sweat. That's
I was going to call it sweat, but
sweat. If you have a little tiny bit of sweat on your body, any little metal thing will stick to you, whether or not you're vaccinated. So no, it's not. It's not. So, and yeah, there's no magnetic component. So in regards to the microchip, I actually did the research to find out how small microchips are. Okay. And so there are actually super, super tiny microchips, but they are not small enough to fit through the needle that we use for COVID-19 vaccines.
Well, that is good to know that because that would even hurt worse. That actually my vaccine when it was actually a pharmacist that gave it to me. It was like amazing. I just felt them put the Band-Aid on my arm. I was like, really? That's it? Okay. I might come back for more, but
that's what I always tell people. You won't even feel it. What you feel is the next day. Like your arm is heavy.
Yeah.
You might get the other symptoms, but
I kind of felt bad because I didn't have a lot of the side effects from it. And I was like, okay, I just sat there all day going, am I going to feel bad? Nope. Okay. Oh, nope. I'm good. Okay. I can carry on what I want to do.
Well, that's wonderful that you didn't have a lot of
side effects.
Yeah, that's great.
I felt bad. Because I was like, other people had some really tough time that next day. And so but I was pleasantly pleased that I didn't have to, so you're a parent, even though your child is 2, but you have nephews, and what would you do to suggest how parents talk to their children going back to school? We had kind of a lull this summer and we all got to take a deep breath, but things are starting to pick back up. What are some words of advice? If you're sitting down, Dr. Tyungu, talking to your nephews, and you have to give them the big aunt talk, what are you going to tell them?
Oh, I did this last week, so I'm happy to answer. My message for them was, I need you guys to keep your masks on. I asked my sister-in-law to get on Amazon and buy them some very sturdy, medical grade masks for their size of their face. And I was like, even if people bully you, even if nobody else is wearing their mask, please keep your mask on. And I told them why. I told them that our hospital right now is full and that we are dealing with a summer RSV surge that we've never had before, ever. Yeah. That's a winter virus that we deal with. So we have very sick children needing oxygen already, and we are very full all the time. And we're already starting to see some kiddos kind of trickle in with COVID and even MISC and different things like that. And so I was telling them, I don't want you guys to need a hospital bed. I don't want you to need oxygen, and just, explaining to them how important it was. Now, I have to tell you, my younger nephew, his mom said, well, if other kids aren't wearing your mask and they bully you, are you going to feel bad about that? And he said, yes. And he did say, honestly, that he might take his mask off in that situation where he felt, and it's so difficult. It's so hard for little kids. And I can tell them all that I can tell them, I can, try to scare them, tell them everything I can about the hospital, and they don't understand,
Right.
So that's why we need rules in place so that there is no bullying, that there's no question, that everyone wears a mask to school, just like you wear your trousers. This is what we do right now until we can get past this point. But I did have one of my patients, his father was like, my 5-year-old son, we live in rural Oklahoma. How is he going to be the only one wearing a mask at school? And all I can do is tell them what we're concerned about, what we as pediatricians stay up at night thinking about, and what we already know. Schools have opened in many places across the country, and outbreaks are happening, and children are being hospitalized. It's a different situation than last year. Yeah. So all I can do is, tell them what I know and really hope for the best. Luckily, my older nephew was like, I don't care if people make fun of me. I'm keeping my mask on.
Right. And I say it often, our children have enough peer pressure before COVID, and it's up to the adults to model what we need to happen. And so, Dr. Tyungu, I'm going to wrap this up, but I'm going to give you one last question. You kind of hinted toward it, but I still want to ask it. What keeps you up at night right now? Besides a 2-year-old.
You almost made me tearful with this one.
This is tough. This is tough times.
Ugh, I'm sorry.
That's okay.
Hold on, let me get myself together here. I think what's so scary for us is that things are already different, and we can already, even from a hospital side, like trying to convince people that what keeps me up at night is thinking about kids that might need us, that we have to turn away because we don't have space. And knowing what I know about Arkansas children, they're full. Kansas is full. Texas is full. Like, if we don't do the right thing for our kids, what are we gonna do? And we're already short nurses. Like, I don't know if the public knows that we have been dealing with this for so long, and nurses are so hard to come by. We don't have enough respiratory therapists, and I guess what they went through, what all of the adult towers have gone through with losing patients, like, I don't know how we could possibly survive that. Children are not, it's my thought, children are not supposed to suffer or die or anything like that. And so what keeps me up at night is the thought that any COVID illness that comes through our door could have potentially been prevented, especially in children that are old enough to be vaccinated, or how much could simple mitigation that we already know works, and that we already know, kids, yes, there are a few kids who have issues and can't wear masks, but if we put masks on everyone, we can protect those kids too,
Right.
And it's the unknown, right? It's the unknown future that maybe I'm just so worried about something that won't happen at all. But that's what keeps me up at night, is the thought that we would have to turn kids away, or that kids are, sick, or that we don't have an ICU bed and someone perishes because we didn't have an ICU bed available. Or if we're full with kids with COVID and RSV and someone gets in a car accident and we can't help them. That's what.
Oh.
I'm so sorry.
No, my heart. You hit my heart. Because it's about our kids. It's about all of Oklahoma. This isn't just an education issue. This is a public health issue. And Dr. Tyungu, I do not have the words to express our appreciation for what you do each and every day, and being a champion for our kids. So thank you so much. Thank you for being on with us today. And we look forward to continuing this conversation with you. And hopefully we're going to come back one day and we're going to have this humongous party. And we're going to just say,
great,
we kick this in the hiney and we're done.
My biggest hope is that a few months from now, people can say that doctor was all worried for no reason and we're all fine. And I think that would be the best news.
Well, thank you, Dr. Tyungu, and thank you for being with us. We appreciate it.
Thank you.